Fellow Gambians, I have the great honor and pleasure to read a statement on behalf of the Honorable Minister of Interior on the occasion of the commemoration of the World Drug Day. Tomorrow, 26 June 2024, marks the commemoration of the International Day Against Drug Abuse and Illicit Drug Trafficking, also referred to as World Drug Day. A day when anti-narcotic institutions and collaborative partners in the fight against drugs and related activities reflects on the achievement made over the years, highlight challenges, educate and sensitize the public on the danger of illicit drug trafficking and abuse, as well as foster public support, cooperation, and participation in the crusade on drugs and related activities. The United Nations General Assembly on the 7th of December 1987 passed Resolution 42112 that set aside the commemoration of this day as an expression of the international community's determination and commitment to strengthening actions and cooperation against all forms of drug abuse, illicit drug trafficking, and related transnational organized crime. This year's theme, the evidence is clear. Invest in prevention, stresses the importance of adopting a scientific evidence-based approach that prioritizes prevention, treatment and care, harm reduction, and alternative livelihood programs in solving the world drug problem. As such, we must intensify efforts aimed at strengthening our supply suppression regime. We must also integrate and prioritize person-centered drug demand reduction initiative aimed at preventing the onset on drug abuse, providing treatment for substance use disorder, aftercare treatment, related services, and alternative livelihood programs that will effectively respond to the drug problem and efficiently abate prevalence of the dealing, trafficking, and abuse of drugs. While we remain committed to promoting this year's theme, we are equally determined to ensure that we dismantle any organized criminal network that may emerge in our jurisdiction. We deal with any such group without compromise to safeguard our society, especially the youth, from miseries and the sufferings caused by the use of illicit drugs. The Gambia, through the Drug Law Enforcement Agency and the relevant stakeholders, has over the years been proactively implementing drug demand reduction programs and activities such as weekly radio talk shows, school sensitization programs, community outreach initiatives, and capacity building training to boost the capacity of youths, civil society organizations, and community-based organizations engaged in preventive drug demand reduction programs and activities. Similarly, Drug Law Enforcement Agency has been launching drug-free clubs in several schools across the country, just to name a few. Regarding treatment and care, the agency, with funding support from the United States Bureau of International Narcotic and Law Enforcement Affairs, collaborated with the Colombo Planned Drug Advisory Program in organizing a year-long training on the Universal Treatment Curriculum, also known as International Standards in Drug Treatment, for relevant stakeholders such as DELIC, the Ministry of Health, Psychiatric Nurses, Department of Social Welfare, CSOs, JITOC, religious leaders, and 2 reformed drug addicts. DELIC in 2019 secured funding from the ECOWAS Commission Drug Unit for the establishment of a specialized drug treatment facility in the country. This was delayed because of COVID-19. However, it is in progress. Fellow Gambians, the 2023 World Drug Report indicates that global drug usage continues to increase with a sharp rise in the global production and seizure of cocaine, methamphetamine, cannabis, and varying forms of synthetic drugs. The World Drug Report 2021 also mentioned that by 2030, Africa will account for 40% of the 11% projected increase in global drug usage. It also indicates a substantial disconnect between real risk and public perception regarding the harmful use of cannabis. It states that while the potency of cannabis quadrupled, there was a 40% decrease in the perception of youths who perceive its usage to be harmful. Today, the Gambia and other neighboring countries are witnessing increasing seizure of cocaine in transit, controlled drugs like methamphetamine, tramadol, and varying strains of cannabis like Kush and skunk cannabis, respectively. This shows the changing trend in the abuse, dealings, and the trafficking of illicit drugs, which have serious consequences on the health and well-being of our people. Therefore, as a government, under the able leadership of His Excellency President Adama Barrow, President of the Republic of the Gambia, the Ministry of Interior will continue to support and promote initiatives aimed at promoting evidence-based prevention and treatment programs and activities. We call on civil society organizations, community-based organizations, youth groups, and all relevant stakeholders to complement government's effort and participate in drug prevention programs and activities. We also call on the public to be vigilant and report suspicious drug-related or criminal activities to law enforcement officers. It is imperative for us all to collaboratively work together with renewed commitment and dedication to end this endemic for a safer, healthy, and drug-free society. Finally, I thank you all for your kind attention and assure you of Delegate and my ministry and the Security Services commitment and dedication in making the Gambia safe, secure, and drug-free. I thank you all.